I'd like to ask the congressman if he's ready, because I know he had some opening remarks for folks. Congressman?
Hello, everyone. How we doing? I want to just thank you all for being here in the Chino Hills Town Hall. Over the next hour, I'll do my best to answer as many questions as I can. I'm here to talk about the coronavirus pandemic, the federal government's response, and answer your questions live. On my website, you can find information, resources, and frequently asked questions on the crisis. As more people continue to get on the town hall, I just want to take a moment to talk about the work that my team and I have been doing for the 39th District. We've been able to respond to nearly 1,000 calls and voicemails throughout this crisis from constituents who need help and support. And I guarantee you that we will get back to you if you haven't heard back from us yet. We are prioritizing those individuals that need immediate help and support, but we will call you back if you haven't heard back from us. We've been able to bring back over 131 million in coronavirus aid for cities, counties, health centers, students, universities, and colleges in the district. Congress has passed 5 bipartisan coronavirus response bills aimed at supporting our workers, families, healthcare workers, and small businesses. The first one provided $8.3 billion in emergency supplemental funding to combat the epidemic, including funding for research and development, local and state health agencies, and small businesses. The second one was designed to expand sick leave policies, strengthen testing, and also, again, to support our small businesses. The third one, the CARES Act, provided economic relief aimed at supporting workers, small businesses that were affected by the coronavirus. The fourth bill was additional funding for hospitals, healthcare workers, testing, and small business programs. And last Friday, the House of Representatives introduced the HEROES Act, which will provide more economic relief to our cities and states, small businesses, workers, and provide more funding for testing. That's my Washington update. You know, I would tell you we've been back in DC, here in the heart of the district. I've been working closely with leaders in the cities and San Bernardino County. Chino Hills is very important to me, and I want to say that as though things are right now, it's been very gratifying to see how the people and leaders of the city have pulled together. We're, of course, very proud of our medical workers who have been working very hard at Arrowhead Hospital and the County Health Department, who are on the front lines of this pandemic. I also want to single out our Sheriff's Department there and the Chino Valley Fire District. The Fire District is an extension of our medical system and has been especially proactive in this response. Even as other public safety agencies in my district have struggled heroically just to maintain services, Chino Hills Fire has created a new program serving our seniors, SOS program to deliver food and necessary items to our elders and others who are high at risk. This has been a great example of their response, and it makes me proud to represent Chino Hills. So I know you all have a lot of questions, so let me just go ahead. We'll stop my comments here and we'll go ahead and get started.
Congressman, the first question we have is from Brad. Brad, I'm gonna go ahead and unmute you.
Thank you, Stephanie.
Congressman
Congressman Cisneros, I actually have 2 questions. One relates to the Postal Service Act of 2006. Are you guys looking into the possibility of redoing that so that the onerous burden of a 50-year pension plan and fixing the rate of postage may be reviewed, and so that, you know, the likelihood of the Postal Service having to be either bailed out or going under is no more? And then with regards to your roles on the Defense Department subcommittees, since we've looked at how, you know, the Theodore Roosevelt was, you know, put out due to, you know, COVID, can we, and since that is kind of a fatal flaw in having so many people on board one ship, will you guys look at possibly spending more money on the American class in a carrier support or in the carrier role compared to its current role as a landing platform for helicopters and other ships compared to the Ford class?
Let me answer your first question first. The post office, definitely, right? That's something and we've been looking at and something that I've been advocating for that we need to change. Um, you know, the legislation that you mentioned there, the Postal Act of 2006, put an incredible burden on the post office to fund their pension plan 50 years in advance. And if it didn't have that requirement, there's no other, I think, public agency or private agency that has done that. And if it wasn't there, the post office would actually be showing a profit. We need to give the post office flexibility too. We've kind of handcuffed them in that legislation as saying how much they can charge and what it takes them to be able to raise their prices. You know, the president says that, you know, it's continually saying that we need to raise the prices, or the post office needs to raise their prices. But the problem is they can't do that with that legislation that you mentioned. So we need to make sure that we help the post office out. It's an entity that we all rely on. And I know we think with email and everything going on, we don't use it as much as we used to, but it is still something, a government entity that's been around since even before the beginning of the country, and we need to make sure that it continues on. The post office goes into a lot of those rural areas that just no other FedEx or UPS won't go to. You know, we all rely on the post office more than we think we do, and we need to help. We need to help support it, and we also need to redo that legislation to make sure that we alleviate that burden that we put on the post office, so that they can be more financially stable. And you know, the other thing, you know, we're talking about bailing out the post office right now, but the other thing I want to make sure that everybody understands as well is that the post office doesn't receive any federal funding or any support, you know, on a regular basis. It's meant to be self-funding, and that's the way that it's been operating, you know, for years now. On your second question, you know, the outbreak in the Teddy Roosevelt has been a big concern to us, you know, on the House Armed Services Committee. It's something that we looked into. We had several calls regarding what was going on there and how they were taking care of the sailors. Being on board ship and being a Navy veteran, knowing this, having lived on ship, you have whether you're on a small ship or whether you're on a large ship, you have a number of individuals that are living in a confined space and really kind of living on top of each other. Look, living quarters have gotten a little bit better. I know when I was on my ship, the USS Ogden, that was built during the 60s, when I was there serving on board that ship in the 90s, they had berthing compartments that slept over 90 people. They're not making them like that anymore, but you know, you have people in a space. You could have as many as 10 people in a confined space living together. And the one thing that we found out with this virus, whether it be a Navy ship or a cruise ship, is that the virus does tend to stick around and confine and stay around metal surfaces. So this is something the Navy's been working on. You know, going forward, we know that it is something that we need to do, because they still need to operate. They still need to be able to go and do their operations, but they also need to make sure that everything is being done in a safe manner. And really, one of the things that we've hold on. One of the things that we've been fighting for is to make sure that they have the material, the PPE that they need, that the mask and everything is there for them. All right, thank you. Sorry for that little interruption.
Thank you, Brad.
You have a question?
I'm doing a scavenger hunt in my Zoom, and I need a picture or a photo of somebody I love.
Okay. All right. Can I get you that later?
Here.
All right.
Take this and go. Hurry up.
All right.
Go, go.
Okay. Thank you. All right.
Thank you, Christopher. That was a lovely interruption.
That was actually Alexander. That was Alexander.
Excuse me. So, Congressman, I was going to take our next question, and it's from Velvet. Velvet, you are unmuted. Velvet, were you there? Let me try, and she may not be unmuted. Velvet, I'm going to try and come back to you. I'm going to read a question from Candy Suarez. Candy asks, can the president withhold funds from states for any reason? And actually, that's from her husband, Reggie, by the way.
Mm-hmm. No, look, the president, Congress has the power of the purse. It's very written, very there in the Constitution as to who provides the funding. That's done by Congress. The president is supposed to be the executor of these funds. The money that we allocate is the money that he is supposed to make sure that it gets to where it needs to go. You know, according to the Constitution, the president doesn't have that power to take the funds and do what he wants with them. You know, this is, I know, kind of been an ongoing battle, but you know, those states, if they've been allocated funding, you know, they will get the funding. That's what needs to happen. That's what we've in Congress have said would happen, and it needs to be followed through.
Thanks very much, Congressman. So our next question, and I'm still looking for Velvet. I just asked her to type her question. I'm not sure if she can do that, but I'm going to go to Aaron Gilman. Aaron, you're unmuted. Go ahead and ask your question, please.
Hello, Congressman. Thank you for your time. Notably missing from the HEROES Act was some form of UBI or recurring cash payments. I was curious where you land on that sort of policy, seeing as a lot of people are currently out of work or missing their jobs and currently still waiting for their stimulus or other forms of means-tested relief.
Well, you know, what we've done in the CARES Act and the other legislation that we passed, we expanded the unemployment insurance for numerous individuals, so that anybody who's been furloughed or been laid off, they're going to be able to get their unemployment insurance. Now, I know a lot of people are still waiting to get that payment from the state. The way that money, the way the program has worked was basically we use the infrastructure that we have in place already, which is each state has its own department within its own government that supplies here in California. It's the EDD that does the unemployment insurance payments that go to those individuals that have been laid off or furloughed that are out of work. So we applied that money to the state of California. They're doing their best to get out. I mean, look, I know people are want their funding. They need the support. They've been out of work. They still have, you know, they need to take care of their family and to make sure they have shelter and food for them. But I will tell you this: the EDD department here in Canada, they're working as hard as they can. They had just been overwhelmed. You know, we have almost, I think in California, it's around 3.5 million that have been out of work right now in this short amount, just in a matter of months where this has happened. Even during the crisis that we had in 2008, those numbers didn't approach anything to being that large or that big. And so they are really overwhelmed right now, and they're working as hard as they can to make sure that everybody gets their money. So again, right, I know it's tough and it's hard right now, and people need the funds so they could take care of their family. But you know, we have to stress patience with this process right now. You know, if your claim has been accepted, you will get your funding. It just may take a little bit longer than it has taken in the past, and that's just due to the volume of requests and claims that they're getting right now.
Thank you for that, Congressman, and thank you, Aaron. Congressman, I'm going to go to a question that was asked in the chat, another one. Jeff Vaca, he would just like, Jeff would just like an update on PPP being extended from 8 weeks to 24.
So good question. So in the HEROES Act, originally, the legislation that we passed, we said PPP would be good. You would have to use the funds within 8 weeks and be whole again during that time. Right now, we know that's not realistic. So in the HEROES Act, we've extended that period of time from 8 weeks to 24 weeks. That would pretty much take us through the end of the year. And so you would have, instead of having that 8 weeks to use that funding that you received and become whole again with your employees, that's now been extended. Well, it would be extended in the HEROES Act. We still need the Senate to take up this legislation and get it signed by the president. But that is something that we've been advocating for. I've been advocating for this, and we will continue to advocate for this. The 8 week time frame right now is not realistic, and we do this. We went into this knowing that there may need to be adjustments, and the HEROES Act provides for those adjustments. And like again, it would take it from 8 weeks to 24.
So thank you very much, Congressman and Ray. The next question again from the chat, and then I'm going to go to Ray Coffin. But this question comes from Marjorie Melvin, and she'd like to know, she says, Congressman, African Americans are disproportionately dying from COVID-19. And in reviewing the HEROES Act, there was no funding to address the disproportionate effects of the disease on African American communities. Why were there no specific policy concerns in the HEROES Act to address this issue?
Well, in the HEROES Act, we did provide additional funding for our medical facilities for the hardest hit regions, which would include those areas that are populated by people of color. Disproportionately, you're correct, right? People of color have been dying at a higher rate, both African Americans and Latinos. Right now, we're seeing what's happening in the Navajo Nation. That's become the most heavily concentrated area where it's been infected. Right now, it's population-wise, percentage-wise, it's worse than what New York had been. And these are historically been areas that where people haven't gotten a lot of health care and a lot of services, and really they've been affected by a lot of things, whether it be diabetes or hypertension that have affected their health overall. So what we've done in the HEROES Act, it may not have called out specific communities, but it did make sure that funding would go to these areas that would need it most, where that have been disproportionately affected, which will include those communities of color. We also made sure that, when it comes to funding education, right, that we did more for minority serving institutions and historically Black colleges. So again, right, the funding is there. We are providing the funding. It may not have named them specifically by community, but the resources are going into those communities where they have been highly affected, which we know are those minority communities where it's disproportionately affecting them. And so this is why it's another reason why it's important that we pass the HEROES Act and really support those communities and the healthcare. But just overall, I will say this, and this is something that the Surgeon General talked to us about on a call, and I have to agree with him. He's right on, right? One of the reasons why it's affecting these communities, these low-income communities, these communities of color, is just because historically these communities have been underserved when it comes to healthcare, and they haven't been getting the medical coverage and everything that they need in order to maintain their health. And so this is something that we're going to need to do going forward, is to make sure that we provide resources and that we continue to support programs like the Affordable Care Act, where people can have access to insurance, high quality, affordable health care, because the lack of health care is really what is contributing to the effect of the virus, being so damaging into those communities.
Thank you, Congressman, and thank you, Marjorie. Congressman, I'm going to take another call. Ray Coffin is on the line. Ray, I'm going to unmute you now. Go ahead, Ray.
Congressman, thank you for taking the time to speak with us today. I really appreciate this opportunity. I'd like to ask another question that focuses more on the longer term. While I completely agree with the need for immediate support to people that are really being hit hard and struggling right now, I'm also concerned about some of the analysis that we're hearing that a really high percentage of the jobs, particularly those that affect lower income individuals, may just not come back. And I feel it personally because my wife and I are trying to decide whether to continue her business in the face of the complications that are coming out of this. And I suspect a lot of other small businesses are facing similar kinds of issues. The question I have really was stimulated by some comments I heard from Rahm Emanuel over the weekend. And he pointed out that with the interest rates where they are, the cost of money where it is, now seems like a perfect time to take another shot at mounting the incredible number of infrastructure projects that this country, I believe, needs to address if we're going to build this economy and keep up with the world. And also specifically regarding employment, the need for not only providing extensions of unemployment insurance benefits, which I absolutely agree are necessary, but to look at training people for the long term for some of the jobs, some of them undoubtedly in healthcare, some of the environmental technology that I think we are on the cusp of rolling out. My question is there any hope that the Congress will address these issues that it feels like have been in a logjam for seems like a decade?
Yeah. Well, thanks for the question. Look, the one thing we know of, coming immediately out of this when this happens was the country starts to open back up. Things are not going to be the same as they were before. We still need to make sure that we find a virus. We still need to make sure that we find a treatment for this COVID-19 to bring people back into a comfort level where they can feel that we can go back to the normal that they knew back in, let's say, February of 2020. For schools, for example, are going to be, there's going to need to be more classrooms. There's going to need to be more teachers. There's going to be fewer students in a classroom. They're going to have to be further spread out. The same thing is going to happen, at our businesses. Businesses are going to have to make not make choices, but really to make adjustments to their business as far as their employees to make sure that they're protecting them, spread them out further, maybe put up protective barriers between them so that they can feel safe. These adjustments are going to need to be made, and it might mean that less people are working on a shift. A lot more people are the one thing that's happened during this is so many people have been working from home that those people may not come back to work, right? And I think Facebook put out a thing today that employees can continue to work from home. So what does that mean, right? If there's less people at a facility, that means there may be less support staff that are at that facility as well. A lot of these corporations like Google and Facebook, they provide services, like they have a cafeteria staff that provides food to their employees. They have, maintenance staff. They have janitorial staff. If there's less people working in the facilities, doing their core mission, then there's probably going to be less people supporting that there as well, because not as many people will be there. So that is going to mean like less jobs. One of the things that we've done in the HEROES Act is we provided funding for retraining individuals. We know that not everybody is going to go back. Even in our restaurants, immediately. People are not going to go back. Restaurants, you may not be able to walk into a restaurant like you used to be able to before. You may have to call ahead and make a reservation. There's going to be less people in the restaurant. So that means less wait staff, maybe fewer cooks and everybody else that's working there. So, there's going to be more people out there looking for a job, but the HEROES Act does provide that funding so that people can get retrained and they can go and move into these different industries that we're so desperate and that we need people in. The infrastructure bill is something that I've been advocating since even before I got into Congress, that we need to do this. And there'd been talks going on early on when I was in Congress about doing a $2 trillion infrastructure bill. And not only is it needed because we have so many bridges that need to be replaced. We have roads that need to be fixed. We need to make a larger investment here, especially in Southern California, in public transportation, public rail, that would help, get people around. These projects would, be beneficial not only for us as a society, but also to help put people back to work. It's what we did during the Great Society, during the Great Depression. That's what Franklin Roosevelt, had his program going, doing these projects. The Golden Gate Bridge was one of those projects that was built during those times. Hoover Dam was also built during that time as well. These are projects that we're going to have to do and invest in order to get people working and to really kind of help stimulate our economy.
Thank you, Congressman. That's quite inspiring. I wanted to go next to Congressman to a question that came in online. It's a really interesting one. It concerns PPP loans, and the constituent writes, is the PPP, the Payroll Protection Program, forgivable for sole proprietors that do not have employees? My business has received approval through the SBA for a PPP loan. Will it be forgivable?
Yes, if you're the sole proprietor, if you don't have any employees, one of the requirements was for the PPP loan is that you had to be whole during this time, right? So if you had 5, 10, 50, 400 employees, by the time that 8-week period was up, which hopefully will be extended to 24 weeks with the HEROES Act, you had to be back up at that number of employees that you had. If you are the sole proprietor, you have 0 employees, you're pretty much good. So, that loan can be forgiven. But, again, if you have any questions, I will say if anybody has any questions about the PPP loan or they want to get, into more specifics, I invite you to call our office, and I'll give you the number, 714-459-4575. If we don't have the answer for you, we will put you in touch with somebody who can get you that answer. But again, we are here to be a resource for you and point you in the right direction and give you that information. But yes, as a sole proprietor, you are good. You don't have to go and hire employees in order to make your loan whole.
Thank you, Congressman. The next question is coming from Jim Gallagher. Jim, I'm going to unmute you now. Go ahead. You're on with Congressman Jim. Jim, we're having some trouble with your audio. I'm going to mute you and then try unmuting you. You want to give it a try again, Jim?
Yeah. Okay. Thank you, Congressman Cisneros, for being here today.
Jim, I think we have
a phone.
You might have 2 devices going. I'm going to mute you, and then
User 1.
you want to try again?
Yeah.
All right, go ahead.
Can you hear me now?
I can hear you
Okay,
now,
sorry,
Jim.
Congressman. Um, we have a serious homeless problem in this country, and I think the coronavirus has shown that. Put me on the phone, please. User number 1.
Jim, I'm going to go ahead and mute you and ask you to type your question into the chat. And then I'll read it for you, Jim, because we're just having a lot of trouble hearing you and getting a tremendous echo. So I'm going to take Candy Suarez has a question. For those who are keeping count, she didn't get 2 questions. It was her husband, Reggie, who asked the first one. So I'm going to unmute Candy. Candy, go ahead. You're on with the congressman.
Good morning, Congressman. Thank you for spending some time in Chino Hills this morning, or with Chino Hills this morning. So I'm concerned, many people are really struggling right now. How can we as individuals reach out to them? Is there an Adopt a Family program in our city related to the coronavirus? We really don't want anyone going hungry. Many of us have backyard fruit trees that we're happy to share, but other than, you know, we don't really know how to connect up with individuals who might need help. Do you have any wisdom on that?
Yeah, there's you know, people have just really been tremendous, you know, people and corporations here in the 39th that have just done a great job of really reaching out to help their neighbors. You know, we've had several companies in the 39th that have really gone out and transformed their business to start making, whether it be mask or PPE gear, to help and really donated that gear to local hospitals and first responders in the area. You know, other individuals have started, you know, passing out food, and I believe there is and I can't, forgive me for not remembering their name right now, but you know, there's an organization there in Chino Hills where they started making meals for individuals in their home, and are passing them out, I think, on a weekly or daily basis. There's other facilities that have been doing that. People have been organizing food banks and really handing out food to individuals that need them. Again, right, call our office, 714-459-4575. We can find a home for your oranges and your apples and your you know, your lemons, whatever fruit you have in your backyard. You know, we'll find a home for it, and we'll put you in touch with people that could use that. So, you know, definitely give us a call if anybody wants to know how they can get involved, or if there's, you know, I've been able to go out in the district to several areas to help at food banks and distribute food. You know, if anybody wants to do that and volunteer as well, you know, we can connect you with organizations that are doing that great work.
Thank you.
Congressman, I'm going to read another question that came in online. It was very similar. I just wanted to point out that somebody else was writing as well. You know, how can we reach out to as individuals to help people who are struggling right now? And as I think you were saying, you know, our office has connected with the city and the county, and there are a number of nonprofits that are still doing good work. So I'm going to type my information in the chat as well, and I can connect folks with some of those agencies that are really doing a lot to help folks. If I could read another question that came in online, Congressman, with the constituent writes, with rising Asian American discrimination and hate crime among the COVID-19 virus, including Trump's non-accountable or non-acceptable public comments, what is the Congress's response and action on stopping the racism?
So, you know, I've been very vocal on this issue. You know, I introduced a resolution with my colleague, Representative Grace Ming from New York, calling out this racism. We've held a town hall with Representative Judy Chu speaking about this as well. You know, it's very unfortunate. You know, there was even an article, I believe it was was either the Washington Post or the New York Times, forgive me, I don't remember it, but an article talking about how some individuals are actually refusing treatment from, Asian doctors because, because of this. That's just, to me, that's just unacceptable. And the fact that, people are discriminating on individuals based on, the way that they look is just unfortunate. And it really is very petty. It's all Asians, whether or not they're even Chinese or not, are facing racism because of the coronavirus and because of where it started in Wuhan, China. These individuals aren't responsible for the virus. They had nothing to do with it. And to really take out your hate or to take out, any of this on these individuals is just unacceptable. So, the one thing I don't want anyone to do is to get in a situation where it's going to put them in danger, where they're going to confront anybody. It's always best to just, as the Bible says, right, turn the other cheek and just kind of walk away. That's always the safest thing to do. If there's somebody there or you're in a facility, let them know what's going on and what you've experienced. But this is happening here in the 39th. We had when we did this forum on this anti-Asian hate that's going on, and we actually had two individuals, and one of them was a young lady just waiting in line at the pharmacy, trying to pick up her father's prescription, and somebody just came up behind her and just started yelling at her and blaming her for the virus. And it really scared her, and then she ran out of the store. Nobody should have to go through that at all. We will not, nobody should have to live through that. So, we're going to continue to speak out on this, but please, if anybody sees this or confronts this, just, it'd be great for you to speak up, but don't put yourself in danger of this. We just need people to be better actors.
Thank you, Congressman. And one thing I'll be posting a link on just in a second is the Congressman also has, this is AAPI Heritage Month, and the Congressman has just extended the opportunity for people to submit AAPI or Asian American and Pacific Islander heroes that we would like to honor in the district. So I'll be posting that information for folks as well. And I think that's, one of the reasons you've been doing that, Congressman, is to combat that very kind of racism. I'm cognizant of time, Congressman. We have a few more minutes left, but I'd like to get to Jim Gallagher's question. He was having some problems with the audio, but he just texted it to me. Jim asks, the pandemic has held a mirror to some of our most glaring issues. For example, shelters and medical care for the homeless. And he writes, I know I have reached out to HUD to help, Housing and Urban Development. I'm also concerned as states are now predicting serious budget shortfalls. For example, California is predicting a $54 billion shortfall. Mm-hmm. How can the Congress help? And he said, sorry about the microphone issues.
No problem, Jim. Thanks for being here. Look, the homeless issue is really, it's been, we know it's been a problem for a long time. And really this, you're correct in saying is that the pandemic has really shined a light on several things. Not only our homeless issue, but even our achievement gap and income gap having to do with students and the resources that they have to continue their education at home. Some of it, for some of our students, it's been very difficult. In the HEROES Act, we're providing $175 billion for renter support to help people get rented so that we don't get more people that end up being homeless because of this situation. So that would be something that would help out families tremendously that could use that support. Right here in California, they have Project Room Key that's helping to get individuals off the street into shelter because on the street, they're more susceptible to not only attracting the virus, but also passing it on to other individuals. And so this is a program that's been done. You know, the HEROES Act provides $11.5 billion in emergency solution grants to local governments that'll help with the housing as well as the health-related issues regarding our homeless population. So the resources are there in the HEROES Act. Again, right, these are things that we've been advocating for, and we need to make sure that we take care of these individuals. As far as the budget goes, yes, California is facing a $54 billion budget program, and you know, in regards to education, you know, we're hearing right now it's about. I kind of talked earlier about the differences that are going to need to be made in our schools, smaller class sizes, more teachers. You know, they're going to have to go and sanitize the classrooms every day rather than just clean them, and so. And this is not only to make sure our students are safe, but our teachers, the faculty, the administration, the maintenance, the cafeteria workers, everybody who's working at a school wants to make sure that they are safe as well, working in this environment, as well as our students being safe. The Secretary of Education here, Tony Thurmond, has said, you know, budget cuts that have been proposed in order to help balance the budget just won't allow the education to do that. We won't be able to make these changes and make these improvements if we're cutting the education budget. But the federal government is going to have to respond, right? And that's one of the reasons why we've done all these stimulus packages and why, you know, the first 4 that we passed have had overwhelming bipartisan support. The HEROES Act, you know, passed through the House of Representatives. We're waiting on the Senate now to act on this bill. They're come up with their own proposals so that we can negotiate. But the only way, you know, everybody's going to get through this, right? Whether it be our states, our local governments, our schools, individuals, is the federal government is going to have to pitch in and help everywhere that they can. You know, and it's not just California is not alone here. And you'll hear individuals talking about how this has just been years of mismanagement, and that's really what you know, nothing could be further from the truth. This is happening all over the country. All our states are suffering. I'm a sponsor of a bipartisan bill with my colleague Don Bacon, from a Republican from Nebraska, who's saying that we need to provide more support to our cities and our local governments, that we need to give them the flexibility to spend the resources where they need to go so that city governments can carry out their mission and really provide for the public safety in their community. You know, in our district, our city's budgets are anywhere from 65 to 75% are going to public safety, supporting and funding our police departments, funding our fire departments. And so, you know, these are things that we need to make sure that these cities have the flexibility and the finances to put these resources where they see fit so they can continue these programs. I haven't talked to any city manager, any mayor, anyone as a member of government here in the district that's talking about how we need this funding so we can put it towards our pension plans. It's all about maintaining services, maintaining public safety. And this is where the federal government's going to have to help out. And there's bipartisan support for it. And even the Secretary of the Treasury today, Steve Mnuchin, has announced that we're going to need another stimulus package to help us get through this.
Thank you, Congressman. I know we're running short on time, and I want to make sure we allow a couple of minutes for your closing comments, because I think you had some things you wanted to end on. But I did want to ask one more question, if you'll allow it. Call in user number 1, so I don't have the name, but this constituent would like to know when will churches reopen?
Look, you know, I'm a person of faith. I attend church every Sunday. I go to Santa Clara, the Assisi here in Yorba Linda, California, where I live. You can always find me there at the 10 a.m. Mass on Sunday. So, you know, I miss church as well. I want to be able to go, and I want to be able to practice my faith. But you know, this is nothing against churches. really it's about our public safety and our health, right? And that has got to be our number one priority. Churches, when people go to church, they're congregated in numbers, in large numbers. Some churches are bigger than others, but you got a lot of people that are close together in close proximity. And right now, that's not the safest place to be. And we found out, whether it's a church or whether it's, other facilities, that when people come together like that, the virus takes hold and it spreads throughout. And really, this virus is spreading very rapidly, and it spreads very easily. My sister right now is living in South Korea. And, she pretty much put out there that the thing that really, the information that they were saying it was happening out in South Korea, why the virus was spreading there and why it was spreading rapidly, was really because of people attending church. And that's where the virus was spreading over there. So look, right now the governor's plan is, as we move through the different phases, he's laid out a plan of 4 phases. Right now, a lot of most of the state is moving into phase 2. That's allowing some small businesses to open, really businesses like bookstores that don't really have a lot of foot traffic. Churches could be in phase 3, where they could start to open up as kind of the numbers start to continue to go down and the risk becomes less. The churches and other institutions and other facilities will continue to open up as well. So, but again, right, our safety and our health has got to be the number one priority. I want to be able to go to church. I'm watching it online. It's just not the same thing. I want to be able to take communion again. But before that, more important than anything is I want to make sure that I can do it in a safe and healthy environment. And that's got to be our top priority.
Thank you, Congressman. I just put my contact information if there are any of the residents who wanted to follow up specifically on this. And I'm about to drop a link to the to the Congressman's Asian American Trailblazer Awards. We've extended this a couple of days. So if this weekend you have an opportunity to send us the names and fill out that form about why you'd nominate somebody for this award, I know the Congressman would greatly appreciate it. So may I ask if you just wanted to conclude with some final thoughts?
Sure. I just want to thank everybody for joining me here today, for taking an hour out of your day to kind of come and listen to me, and so that I could be here to answer your questions. Hopefully this was helpful. If you have a question, or if we didn't get to your question, or if something you think comes up later, give my office a call, 714-459-4575. Like I promise, we will get back to you. We will answer your email. We will answer your phone call. We are prioritizing those who need immediate help and support, but I promise you, we will get back to you. I just want to put out this other bit of information. Nobody kind of brought it up or asked, but one thing, I had been advocating for since the beginning is to provide the support and help to our cities, to our local governments. The HEROES Act would help us do that. And I think one of the reasons that we got this into the HEROES Act was because for my advocacy for it. But the HEROES Act will provide, if passed, and we need to keep advocating and working with the Senate to get this passed and signed by the president, because so many of our cities and states are asking for support. The Council of Mayors, which is made up of mayors from all over the country, and this is a bipartisan issue that both Republicans and Democrats are advocating for, that we need to support local government. The HEROES Act would provide $20 million. I think the city council members there got a little excited, but $20 million in fiscal year 20, and then an additional $10 million in fiscal year 21. So again, I just want to thank you all for joining me here on the Chino Hills Town Hall today. I do want to touch on one other subject before we close. If you haven't filled out the 2020 census yet, please get that done. We rely on the census not only to draw out our congressional delegations and our our congressional districts, but also like our state assembly and the state senate. But more importantly, we use the census data to figure out how we're going to fund areas. So we want to know where that next police station needs to be built, where that next fire station needs to be built. We use census data for that. When we're sending, federal dollars to fund programs, the amount of money that we send is going to be based on the census data that we do in 2020. So if we're undercounting ourselves, the funding is going to be, we're going to underfund the community, and we don't want that to happen. So if you have any questions, if you haven't done it yet, 2020census.gov is the website. You can get more information there. But really, there's a number of ways you can fill it out this year. You can do it online, which is the way I did it. It took me 10 minutes. You can do it over the phone, or you can request, a census form via the mail and do it the traditional way that it's always been done in the past. And it's also available in multiple languages as well. So please get that done if you haven't done it. So again, my office is here to help you and support you. If you have any questions, please give us a call, 714-459-4575. Please make sure you take care of yourself, stay healthy, stay safe, follow the CDC guidelines, practice social distancing, wear your mask. I know we have it's a big holiday weekend coming up, Memorial Day, so happy Memorial Day to everybody, and really keep in your prayers and your thoughts those individuals who help pay for our freedom by making the ultimate sacrifice and giving their life for our country and for us. Please keep them in your prayers, them and their families in your prayers this weekend. Stay safe out there. Take care of yourselves. Take care of your families. And I'll talk to you later.